Hello students, this is Unit 4 of our lecture of our module. It begins here. And here we look at pregnancy problems. Pregnancy problems cause great mental distress amongst our families. Now we look first at chromosomal disorders. They can occur because of an issue during meiosis. They may cause too many or too few chromosomes in the cells of the zygote. And two types of chromosomal disorders are sex chromosome disorders and disorder on the 21st chromosome, which we know as Down syndrome. Sex chromosomal disorder can result from an extra X and an extra Y, or only an X and no second chromosome. Common consequences of such include cognitive deficit and abnormality in the reproductive system at puberty. So that is something that we look at. Now, Down syndrome is identifiable by physical characteristics and has also cognitive deficits such as speech problems, mental retardation, social development varies, and lower life expectancy. Now, chromosomal disorders tend to not be passed from parent to child. There's usually a relationship between the maternal age and chromosomal disorders. There also may be a relationship between a father's age and chromosomal disorders, but we aren't so clear on that as yet. So with prenatal diagnoses, it helps us with things like amniocentesis, which utilizes the amniotic fluid from 15 to 20 weeks into pregnancy, and cryogenic villus sampling, which utilizes cells from forming on the umbilical cord from 5 to 10 weeks into pregnancy to see if there are any chromosomal disorders possible. Ultrasound is utilized to see how the baby's doing. So I've got a few slides of visuals for those of us who are visual learners to be able to memorize the information. Now we are moving on to genetic counseling. Within genetic counseling, before having children, some of us may seek out that type of extra care to look at if we have inherited genetic condition, or couples with a history of miscarriage or infertility may take genetic counseling. Older couples, which would be women over 35 and men over 40, may also utilize genetic counseling. And so what is genetic counseling? It's the process by which the patients or the relatives at risk of an inherited disorder are advised of the consequences and nature of the disorder, has the probability of developing or transmitting it, and the options open to them in the management of family planning. I have for you a URL on the PowerPoint that you can copy and place in your browser for you to look at. And I have some visuals for you to help with memorization. Now, something which is really interesting is that of open fetal surgery. In open fetal surgery, the mother is placed under general anesthesia and given an epidural to help with pain control. The fetus is actually also given medications as needed for pain control and to prevent movement. The following 5 visuals will show you how open fetal surgery may be conducted. And these visuals are taken from the internet for your purposes. It's not Pearson copyrighted. Brace yourself before you look at them on the PowerPoint. Please remember that we're doing surgery there on the fetus, while the fetus is still attached to placenta and umbilical cord within the womb. Pretty amazing. Now we turn to genetic engineering. Genetic engineering is related to defective genes and replaced with synthetic, normal genes For example, we do it with what is known as sickle cell disease. And I have a few slides for visual learners to enjoy in memorization. Now we're going to turn, and we're almost done now, to infertility causes. For men, there are three main causes of infertility: too few sperm, the quality of the sperm, and low motility. For women, there are many causes, and one is ovulation. There may be an issue with ovulation. So with infertility, since we are a compassionate field and we want to support mothers, families, and also depend on the culture, infertility is taken as a great stressor. So historical treatments of infertility include giving more attention to the wife to achieve mutual orgasm, surgery on a woman's anatomy, and bloodletting. Current treatments are much more advanced. Many treatments utilize assisted reproductive technologies, which we call ART, assisted reproductive technologies, ART. That would be artificial insemination, which injects sperm into the woman's uterus, fertility drugs, which mimic hormones involved in ovulation, and then we have in vitro fertilization, where the ova is removed and fertilized outside the womb, then placed into the uterus. Now, infertility, as I mentioned earlier, has cultural differences. In the West, there may be a sense of sadness or loss as well as marital strain. About half of all couples do say it has made their marriage stronger. But outside of the Western nations, it can be deeply stigmatizing, especially for women. Now, the following visual is from the internet to show the joy of our next step, module number 3 of birth. And I will see you soon at our next module. It's been good chatting.